Hello. I'm Dr. Amir. Welcome to today's health session. Today we will discuss a common disease, earache or ear pain, most common in children. Before we start today's session, it is requested to kindly subscribe and like the channel and share with loved ones and the community for health awareness.
Dr. Amir, what is earache?
Earache, also known as otalgia, is a painful sensation in the ear often caused by inflammation, infection, or pressure changes. It can range from mild discomfort to severe pain and may be accompanied by other symptoms like fever or hearing difficulties. Medical evaluation is important for accurate diagnosis and treatment.
Dr. Amir, what are the causes of earache?
Earaches can be caused by various factors, including ear infections, for example otitis media, middle ear infection, or otitis externa, swimmer's ear. Sinus infections. Pressure changes from flying or altitude. Pharyngitis, sore throat, and earwax impaction. Earwax buildup, foreign objects in the ear. Dental issues, temporomandibular joint problems, or referred pain from throat or jaw issues. Proper diagnosis is essential for effective treatment. Additionally, conditions like Bell's palsy or neuralgia may also result in referred pain to the ear.
Dr. Amir, what are the common problems with the ear?
Common ear problems include ear infections, otitis media and otitis externa, tinnitus, ringing in the ears, hearing loss, earwax buildup, vertigo, dizziness, and eardrum perforations. Other issues involve foreign objects lodged in the ear, benign growths, such as cholesteatoma, and problems with the eustachian tubes, which regulate pressure in the middle ear.
Dr. Amir, who is most vulnerable to earache?
Children, especially those between the ages of 6 months and 2 years, are particularly vulnerable to earaches due to their developing eustachian tubes. People with frequent respiratory infections, allergies, or a history of ear infections are also at increased risk. Additionally, individuals who experience frequent pressure changes, for example frequent air travel, can be susceptible.
Dr. Amir, why do children have more ear infections than adults?
Children are more prone to ear infections due to their shorter, more horizontal eustachian tubes, which facilitate the spread of bacteria or viruses from the throat to the middle ear. Their immune systems are also still developing, and they experience frequent respiratory infections. As children age, their eustachian tubes become more angled, reducing infection risk.
Dr. Amir, what shall I do if I suspect my child has an ear infection?
If you suspect your child has an ear infection, consult a healthcare professional. Watch for signs like ear pain, fever, fussiness, pulling at the ears, or changes in appetite or sleep. Avoid inserting anything in the ear. A doctor can provide accurate diagnosis and recommend appropriate treatment, which may include antibiotics or pain relievers.
Dr. Amir, what can be done to prevent ear infections in children?
To prevent ear infections, practice good hygiene, keep vaccinations up to date, avoid exposing children to secondhand smoke. Promote breastfeeding for infants, manage allergies, and address respiratory infections promptly. Teach proper hand washing and discourage inserting objects into the ear. Follow your doctor's advice to reduce infection risks.
Dr. Amir, what are the signs and symptoms of ear pain?
Signs and symptoms of ear pain include sharp or dull pain in the ear, worsened by chewing or tugging on the ear fullness or pressure, hearing loss, fluid drainage, fever, irritability, in children, dizziness, and ringing in the ears, tinnitus.
Dr. Amir, how is an earache diagnosed?
Earaches are diagnosed through a combination of medical history, physical examination, and often the use of an otoscope to examine the ear canal and eardrum. In some cases, further tests like tympanometry or imaging may be conducted to assess middle ear function and identify underlying causes such as infections or blockages. Prompt medical evaluation is needed if these symptoms arise.
Dr. Amir, what is the first aid for earache?
First aid for earache includes keeping the affected ear elevated, applying a warm but not hot compress, taking over-the-counter pain relievers like acetaminophen or ibuprofen, following the recommended dosage. Avoid putting anything in the ear canal. If pain persists, or if there's fever or discharge, seek medical attention promptly.
Dr. Amir, what is the prevention of earache?
Preventing earaches involves maintaining good ear hygiene, avoiding inserting objects into the ear canal, managing allergies to reduce congestion, practicing good dental hygiene, and promptly treating respiratory infections. For children, ensuring timely vaccinations and avoiding exposure to secondhand smoke can also help reduce the risk of ear infections and associated earaches.
Dr. Amir, what is the treatment for ear pain?
Treatment for ear pain depends on the underlying cause. Over-the-counter pain relievers can help manage discomfort. If an infection is present, antibiotics or antiviral medications may be prescribed. Warm compresses and keeping the head elevated might provide relief. Seek medical advice for accurate diagnosis and appropriate treatment.
Dr. Amir, how long does it take for an ear infection to heal with antibiotics?
Ear infections usually start improving within a couple of days of starting antibiotics. Complete healing may take about 7 to 10 days, but symptoms often begin to subside before that. It's crucial to complete the full course of antibiotics as prescribed by a healthcare professional to ensure the infection is fully treated.
Thank you, Dr. Amir. Sincere thanks to the doctor for the invaluable health awareness session, empowering us with vital knowledge. Truly appreciated.
Goodbye, and remember, prioritize wellness. Stay informed. Together, we can build a healthier future. Stay proactive. Please subscribe to the channel and share in your community for health awareness.